The health sector is working double time to immunize Filipino children against preventable diseases. Latest data show around 1.4 million children born during the COVID-19 pandemic have not had a single vaccine. Even before the pandemic, the Philippines was already among the top 10 countries with the highest number of under-vaccinated or unvaccinated children. Now, to address this, the Health Department, World Health Organization, and the United Nations Children's Fund, or UNICEF, launched a vaccination drive called Chikiting Bakunation Days. Now, to tell us more about this is Dr. Carla Ante-Orozco. She's an immunization specialist at UNICEF Philippines. Good morning, Dr. Orozco. Thanks for joining us.
Morning, Paula. Thank you for having me.
It's great to have you back. Last week, we just celebrated the World Immunization Week, and the spotlight was on the pandemic's effect on the vaccination of children. Do tell us more about this. We're not necessarily focusing on COVID vaccines here, aren't we? We're talking about basic, proven vaccines that have been used for years and decades.
Yeah, so this time, Paolo, with the easing up of COVID-19 restrictions, UNICEF and WHO is supporting the government to ramp up vaccination for children 0 to 23 months old who have missed out on the routine vaccines since the start of the pandemic. So this will be, this has actually started last April, April 28, 29, and it's still happening on the last Thursdays and Fridays of the months on May and up to June this year.
Right, Doctor, it's obviously so important for children to be vaccinated against preventable diseases, but what are we focusing on here? What are these preventable diseases?
We've seen the effects of COVID-19 restrictions. We've seen the effect of the pandemic in terms of children not getting the routine vaccines. And we know that children, especially under 5, are very vulnerable to vaccine-preventable diseases. So amongst these are measles. We've seen the measles outbreaks in the past years because of the low vaccination coverage. And we've also seen the effect of the polio outbreak in 2019 because also of the low coverage. So amongst these vaccine-preventable diseases, we have measles, we have polio, diphtheria can also happen, pertussis. So these are just some of the diseases that can be prevented by vaccines. So for those mothers and caregivers that are listening, we do really encourage you to visit your health centers. These vaccines are safe, they are effective, and they are free.
There you go, the most important points there. They're safe, they're effective, and they're free. Chikiting Bakunation Days, tell us a little bit more about this initiative. Until when will this be held, and which vaccines will be available and where?
Okay, so the Chikiting Bakunation Days, so this is an accelerated catch-up and also routine vaccination drive that's targeting 0 to 23 months old children nationwide who have missed out on their vaccines starting 2020 and 2021, and even this year as well. So this is going to be implemented in all the health centers across the nation, across the different regions as well. So this is going to happen, as I've mentioned earlier, on the last Thursday and Fridays of the month, starting April, May, and June. So the vaccines are available. These are the routine vaccines against measles, against polio, diphtheria, pertussis, also pneumonia. So all of these vaccines, they are available for free in your nearest health centers.
There you go. It's Doc, just to close the discussion, it's not just the difficulty of getting to these centers during the COVID-19 slowdown and previous lockdowns. How can we assure parents and caregivers of the safety, efficacy of these vaccines and really just assure them that this is the proper thing to do?
Well, these vaccines have gone, these are not new vaccines. So these are vaccines that have gone through intensive, clinical trials, regulatory processes, and this has been used in the national immunization programs for many, many years now. The national immunization program in the Philippines started in the 1970s, and these are the same vaccines that are being used. So you can be assured of its safety and also of its efficacy to prevent vaccine preventable diseases. So this is very important. We as mothers and caregivers, we want to show our love for our children, and one of the ways to show this is having their children vaccinated, so that they'll be prevented and protected from vaccine preventable diseases that can cause also deaths among children. So we want our children to not only survive but also to thrive.
Right, and obviously the best opportunity is to take advantage of the Chikiting Bakunation Days. Thank you so much to UNICEF Philippines Immunization Specialist Dr. Carla Orozco.